Hello there everyone, this is 5 Minutes Medicine and today we will talk some things about migraine, which is often confused as just a type of headache, but is a complex neurological disorder which is often characterized by hemispherical, throbbing, and pulsating headache. First, let's take a look at normal physiology of signal conduction, where one neuron communicates with the other neuron through special chemicals or neurotransmitters. Think of it as a relay race, where one neuron passes signal to the other neuron in the form of special chemicals or neurotransmitters. Since we said migraine is a complex phenomena, let's break down its complexity by understanding its stages, where migraine consists of a prodrome or pre-headache phase, which can last from few hours to days, the oral phase, which is usually experienced by 1/3 of the patients and is characterized by visual, acoustic, and mucosal anomalies, from which visual being the most common and is shown here. Headache phase, which is not just an ache, but is a kind of a drilling pain which might last from few hours to days, and a postdrome or a hangover phase, which is characterized by non-specific symptoms like upset stomach, dizziness, etc. So let's understand the mechanism behind the pain. As earlier it was believed that the only reason of pain is overdilation of blood vessel, irritating the nearby pain-sensitive nerve fibers, causing pain. But with the development of science, we came to know that the most important reason is a genetic malfunction, where the person gets oversensitized by a common stimulus, which causes the release of excessive neurotransmitters, which activate certain parts of brain which are responsible for pain, visual, and auditory features. And due to this overactivation, the patient experiences features like excessive pain, light, and sound sensitivity. So let's understand it pictorially. As the blood vessel entering the brain dilates, irritating the nearby nerves causing pain, and excessive release of neurotransmitters over a normal stimulus causing overactivation of certain parts of brain, which causes a condition where the patient feels something like this. Migraine can be triggered by causes like physical and mental stress, staying hungry, sleep deprivation, and alcohol consumption. Hormonal imbalance, especially that of estrogen and progesterone, causes migraine too, which explains why females have higher chances of having migraine than males. As for the diagnosis of migraine, it's based upon symptoms, and the International Headache Society made a brilliant 5-4-3-2-1 criteria for diagnosis of migraine, which can be elaborated as 5 or more attacks without aura, 4 hours to 3 days of duration of symptoms, having 2 or more features from unilateral headache, pulsating nature, and gets worsened with activity, and either of nausea, photophobia, or phonophobia. Primary treatment of migraine depends upon relieving pain, so analgesics and NSAIDs like ibuprofen are used. Drugs like sumatriptan, methylargotamine, etc. are used for severe conditions, and MIDA score is used for choosing which kind of pain reliever would be given for a specific patient. And as for the prophylaxis, beta blockers like propranolol, anticonvulsants like topiramate, and nowadays even botulinum toxins are used. Symptomatic treatment is needed for the patient who experiences additional symptoms like nausea, dizziness, etc. So that's it for today's review on migraine. If you liked the video, please help the channel to grow by liking, sharing, and subscribing. Thank you, and see you until next time.